repair procedures fix scarring or unnatural hairlines?
It doesn't work like that in hair transplants.
What are the risks involved in a repair hair transplant procedure?
I would say a proper planning is one way to avoid any disastrous outcome of a repair hair transplant.
How long does it take to see the final results of a repair hair transplant procedure?
The results are immediate and instantaneous.
So what realistic results can I expect from a repair hair transplant?
The answer to this would differ from patient to patient.
For what length of time they should wait before they should actually approach you for a repair transplant?
They should ideally wait for around 1.5 to 2 years.
Hello and welcome to the podcast on repair hair transplant. Nowadays, when people are opting for hair transplant regularly, थोड़ा भी अगर हमको baldness है तो हम चाहते हैं कि हमारे family and near and dear ones अपना hair transplant कराएं so that they look good and they have proper hair to comb. ऐसे में there are so many cases which are happening in which there is some problem so that the person who got the hair transplant done and their family, they're not satisfied. They think कि अच्छा नहीं हुआ and a repair or redo hair transplant should be done. Let us discuss in detail with Dr. Satya Saraswat. Welcome, sir. So my very first question would be, what are those issues or problems in which you feel there should be a need for repair hair transplant?
Basically, the concern is from the patient side. Whenever they have undergone a hair transplant and they think that their hair transplant was not up to the mark due to any of the reasons, basically there are 5 or 6 different reasons for which the patients approach us regarding a repair hair transplant. The first one which we see is a poor density of the transplanted hairs. This can happen due to various reasons. Sometimes it is due to some of the rare skin disorders in which the growth of the hairs does not happen, and these are now being identified more and more, such kind of conditions in which the hairs are not grow properly because of some skin related issues, and in these cases we do a biopsy to rule out whether such underlying problems like FAPD or FFA or LPP or other problems may be there. Second thing for which they come to us is unnatural hairline. Unnatural hairline can be of 3 or 4 different kind. It can be very straight hairline. Ideally, it should be irregular, but people do come with a very straight hairline. Second thing is a low hairline done early in their youth, early in the age, and when they sort of age up after 5, 10, 15 years or so, that low hairline starts looking unnatural, and they notice that people are actually noticing that kind of hairline.
So in this case, people come after a gap.
Long.
Yes.
Yeah. The third problem for which people come if they have unnaturally placed hairs in the hairline, that instead of them being a single or soft hairs, they are mostly multis, and sometimes they are in parallel rows, which is known as railroading. Multis and rows can happen, especially the multis happen in FUT transplants, because when we are taking out a follicular unit, some of the hairs may be in particular follicular unit, may be in a sleeping or catagen or telogen phase, and when they're transplanted, they come out. And sometimes when making the slits, if the hairline is not made that irregular, there can be 2 parallel rows also. So this is the second kind of problem for which they come for the correction, and that is for the unnatural hairline. The third one is incorrect angles and directions of the hairs in any of the areas which have been transplanted. As we know, the angle varies from one place to another in a scalp. It's generally much more acute, 20 to 30 degrees or sometimes 30 to 40 as we go backwards. But if a transplant is done perpendicular and they are growing out perpendicularly or vertically or between 70 to 90 degrees, it looks unnatural. Apart from this, direction also is important. Our natural hairlines on the left hand side are directed towards the left. Say this is a hair, and on the left hand side the hairs are directed towards the left hand side. On the right they are directed towards the right hand side, and in the middle they're coming out like this. So this angle, if it is too high, or the direction, if it is very unnatural, gives rise to unnatural results after a transplant. And this is also one problem for which patients come out and seek a repair hair transplant. Another thing is poorly done temple points, and now we are seeing a lot of patients, because there are many clinics who are doing temple points even if they are not required. Even if a minimal temple thinning, they are doing temple points. The angle normally in temple areas is 0 to 10 degree, which means they are flat. The hairs are coming out flatly. But when we are doing the hair transplant, we are making the slits, it is quite natural that it will be at some angle at least. We just cannot go and transplant the hairs very, very flat. So in these some cases, the hairs, they grow out like this and it looks very, very unnatural. Or the fifth problem for which patients do come to us is donor over harvesting. Excessive harvesting from the donor side without actually knowing what is the baseline density, how many roots should be left or the follicular should be left in the donor area so that it doesn't look quite thinned out, and multiple times by the same procedure. Like we had a patient in whose case 3 times FUE was done from the scalp and his donor site was absolutely over harvested and devastated. And the last problem for which patients do come to us is having a very bad FUT scar or sometimes FUE scars also. So these are the basic 6 problems for which patients come and seek a repair hair transplant.
So just to sum up, let us see what all problems people have for which they come for repair. First of all, they can have a bad density, very less number of hair growing out. Secondly, hairline can be improper, very low, or the angles of the hairs coming out at any place can be bizarre, weird, and then the frontotemporal angle or the temple points can be bad looking. Then at the donor side, the harvesting can be over harvesting. So there is a lot of scalp show at the back, which defeats the point of hair transplant.
And then bad scars.
Yes, and bad scars. To know more about how we planned a repair hair transplant for somebody who had bad experience with previous 3 hair transplants, you can click on the link above. So how common have these repair hair transplants have become in 2024?
Now we are seeing a lot of patients coming for repair hair transplant as compared to the previous times. Now a significant portion of our practice is now of repair hair transplants. I would say like around 5 to 10% patients of our practice are now
that's quite
repair
significant.
hair transplant.
So suppose somebody got a hair transplant done. So for what length of time they should wait before they should actually approach you for a repair transplant?
If it's about the density, that kind of concern is there, or scarring concern is there, they should ideally wait for around 1.5 to 2 years, because they say that in rare cases the new hairs can keep on coming till 18 months and very rarely up to 24 months also. But it's good to wait till at least 2 years before planning a repair hair transplant.
So they should see the full effect of previous transplant first, and then they should come. So if you guys have a question regarding a hair transplant procedure, you want to ask something about somebody who got something unsatisfactory done in a previous surgery of hair transplant, you can ask in the comment section below. My next question would be, what should we look for in a person to whom we should approach for the repair hair transplant, to the consultant?
If you're planning a repair hair transplant, ideally you should be looking out for a doctor. They have a good experience level and they are credentialed, because many times now we are seeing a lot of non-credentialed doctors also performing the hair transplant. Doctor should ideally be a member of ISHRS and ABHRS, and they should be attending all the scientific meetings like ISHRS World Congress, which is held once in a year. Not just attending, but if they are presenting their own scientific work also in these meetings. And apart from this, you should see if that doctor is involved in training other doctors also. Is he a mentor to the junior doctors who want to enter this field, and they are sharing this knowledge? So sharing means basically they are well experienced and they have that orientation to teach and discuss this art and science of hair transplant with the newcomers. Apart from that, the doctor, repair hair transplant doctor, should be well versed in FUE technique, FUT technique, because in a over harvested FUE patient, you may need FUT also, and in a poorly done FUT, you may need a FUE also. Apart from this, he should be well versed with body hair transplant technique also, especially for the beard. Very important thing which is coming on now is that the clinic or the doctor, they should be doing scalp micropigmentation also, because it's a wonderful tool to achieve more with a less invasive procedure, and it works wonderfully in many of the patients in a repair hair transplant.
So the center to which you go should offer you all the possible tools in the field of hair restoration.
Apart from this, the planning of this repair hair transplant should be done in a clinic where advanced gadgets and tools like advanced trichoscopy is also used, and this planning has to be scientific in all the cases. It should not be something that 2000 graph, 2500 graph, just randomly any number coming, or yes, we will give you a guaranteed 100% results. It doesn't work like that in hair transplant. So the planning has to be very scientific.
So long-term scientific planning should be there for every patient. And if you feel there is somebody in your family or you yourself need a repair hair transplant or a primary hair transplant, you can contact us on the numbers below, or you can WhatsApp us so that we can have a consultation. We all know that primary hair transplant is the most important one, but suppose I need a repair hair transplant. So what realistic results can I expect from a repair hair transplant?
The answer to this would differ from patient to patient.
Problem to problem.
Problem to problem, the kind of problem they're approaching with. Most of the times, I would say like 70 to 80% time, there is some improvement which can be done. Although it also depends on the kind of analysis we do for an individual patient, and the repair hair transplant analysis and planning. It may take us hours of consultation also. Like sometime it can vary to 2 to 3 hours also after doing a detailed trichoscopy, analyzing, prioritizing different areas. There are rarely some patients in which nothing is, no improvement kind of thing is also possible, and this has to be discussed on case-to-case basis.
But for maximum people,
there is some improvement.
There is scope of improvement. Yeah. So there is a lot of debate whether FUT is good or FUE is better. So we have a video here in the link above where you can see which hair transplant is better, FUE versus FUT. So doctor, how long does it take to see the final results of a repair hair transplant procedure?
So if it's just like improving upon FUT scar or over-harvested hair transplant where we're doing a SMP kind of procedure, the results are immediate and instantaneous, although it may need more than one sitting. If some unnatural temple points or straight hairline graft have to be extracted, this may be needed to be done more than one time. Not a single procedure may be sufficient, but it may take a couple of months till the scarring and all subsides. And if you have added up or topped up the number of grafts in a poor density hair transplant, or you have done another hair transplant per se, if that again may take around 1.5 years or 2 years to see or show the final effect.
So anywhere between immediate to 1 to 1.5 years. So just out of curiosity, can repair procedures fix scarring or unnatural hairlines?
Yeah, if the scarring is just like a bad FUT scar which is matured or over-harvested donor site because of FUE, this can be corrected by doing scalp micropigmentation. Sometimes we may need to do a hair transplant into a bad FUT scar also. But if there is a keloid or a hypertrophic scar, these are the kind of problem which are very difficult to treat. So if you are going for planning your primary hair transplant, and if you have a keloidal tendency, you should definitely talk to your doctor before actually undergoing the procedure, and you should disclose it because it can sometimes be the hidden area and may miss out the glance of a hair transplant doctor. So if you have those kind of problem, you should definitely disclose it at the time of the first hair transplant. Regarding unnatural hairline, if it is low hairline, it can be corrected in multiple procedures. And if it is a straight hairline, it may need graft extraction, as we have done in many of the cases.
If there is somebody you feel who is in need of this information, please share this video with them so that they are benefited by it. Again, doctor, safety is very important. Just tell me, what are the risks involved in a repair hair transplant procedure?
I would say a proper planning is one way to avoid any disastrous outcome of a repair hair transplant. This is very crucial. Many a times it may need more than one sitting. For this, you really need a lot of patience before actually, planning out a repair hair transplant with any of the doctor. Poor planning goes a long way in avoiding disastrous outcome of a repair hair transplant. Results of repair hair transplant is never ever as good as the first hair transplant or the primary hair transplant, and the resources become limited in every successive repair hair transplant. We request you to choose the best clinic in the first sitting itself so that you actually do not need a repair hair transplant, and a good clinic would always tell you about the potential limitations, complications, chances of failures in the primary sitting also itself. And they will discuss all the procedures like FUE, FUT and everything in detail. So please choose a clinic in which a doctor or a hair transplant surgeon is giving you a lot of time discussing your all cases scenario, talking about the complications, talking about the side effects, its limitation. This is very, very important, because if you just go by cost, low cost and terms like guarantees and all, this may be disastrous for you in the long.
Absolutely. So thank you so much for enlightening us regarding the repair hair transplant. If you want to see a latest hair transplant case study, please click the video on the left. And if you want to know more about whether FUT is good or FUE is good, FUT versus FUE, please click the video on the right.